Hi class, in this video we're going to talk about the female reproductive system. Okay, so the female reproductive system is a bit more complex than the male reproductive system because of potential for pregnancy. So there's a lot more that can go on. Okay, so ovaries, these are the female gonads, and they produce the female gametes, which are ova. Okay. Ovaries also secrete the female sex hormones, estrogen, and progesterone. Okay. So internal genitalia are located within the pelvic cavity. So this includes the ovaries and the duct system, which includes the uterine tubes, the uterus, and the vagina. And then the external genitalia are the external sex organs. Okay. So the ovaries are paired glands and they're homologous with the testes in the male reproductive system. Okay, and they're supported by the broad ligament, which I showed you in the anatomy video, the ovarian ligament, and the suspensory ligament. So blood supply for the ovaries, they have an ovarian artery, which branches off of the abdominal aorta, okay? And there is an ovarian branch of the uterine arteries, okay? So they're gonna travel through the suspensory ligament and the mesovaria, okay? The ovaries are surrounded by the tunica albuginea, and then that is covered by a cuboidal epithelial layer. Okay, so this is known as the germinal layer, and it's continuous with the peritoneum. Okay, so it has the ovary also has a cortex and a medulla. The cortex is what houses the forming gametes, and the medulla has blood vessels and nerves running through it. The ovarian follicles are sac-like structures that are embedded within the cortex of the ovary, and they contain the immature egg cells. So those are oocytes. Okay. Each month, a follicle is going to eject an oocyte, and this is the process known as ovulation. So when that oocyte is ejected. Okay. So the uterine tube system includes the uterine tubes, uterus, and vagina. So let's start by talking about the uterine tubes. Okay. These are also known as the fallopian tubes or oviducts. And they are what receive the ovulated oocyte, and they're the site of fertilization if fertilization does occur. Okay, so each tube is about 4 inches long, and it extends from the ovary to the superior portion of the uterus. Okay, so the regions of the uterine tube include the infundibulum. So this is the opening into the peritoneal cavity, so it's kind of shaped like a funnel. Okay, and then coming from the infundibulum are the fimbriae. So these are those finger-like projections I showed you that drape over the ovary. Okay. Then there's the ampulla. This is half of the uterine tube length, and the ampulla is specifically where fertilization occurs in the uterine tube. Okay. And then there's the isthmus. This is the narrow medial third of the uterine tube, and it empties into the superolateral region of the uterus. Okay. So during ovulation, the uterine tube is what captures the oocyte. Then the fimbriae are going to sweep the ovarian surface, okay, which creates a current so that the oocyte can be carried into the tube. Then it's going to be carried toward the uterus by smooth muscle peristalsis, and by cilia. Okay. There's also non-ciliated cells in the uterine tube, and those help to nourish the oocyte and the sperm. Okay. The uterine tubes are covered by a peritoneum on the outside. Okay, so they also have a peritoneal covering just like all of our other organs. Okay, homeostatic imbalance is ectopic pregnancy. So this is where the oocyte is fertilized and begins developing as well within the uterine tube. It normally aborts naturally, but there's substantial bleeding when that happens. Pelvic inflammatory disease, this is spread of an infection from the reproductive tract to the peritoneal cavity. So this can cause scar tissue in the reproductive area, and it could potentially lead to infertility. Okay, the uterus is a hollow, right? It's open. That's where a baby or a fetus is going to start growing and developing. So it's a hollow muscular organ, so it has very thick muscular walls. Okay, so that's the myometrium, right? We had the endometrium is the inside, then the myometrium, then the perimetrium. Okay. The uterus is normally anteverted, so inclined forward. Okay. Retroverted would be if it was to incline backward. Okay, but normally it's anteverted. And we went through the regions when we talked about the anatomy of the uterus, so I'm going to pass over that. Okay. Homeostatic imbalance of the uterus would be cervical cancer. So this affects 450,000 women each year, and it kills about 50% of them. Okay. This most commonly occurs between ages 30 and 50. So risk factors include STIs like HPV, frequent cervical inflammation, or multiple pregnancies. Okay, there is a vaccine though that you can get when you're about 11 or 12 years old that protects against HPV. Okay, it's known as Gardasil. You've probably seen commercials for it. Okay, Pap smears are very important for early detection. So from ages 21 to 30, they're recommended every 3 years, and every 5 years at ages 30 plus. Okay, so they include HPV testing, and if you catch that early enough, then you could potentially prevent or keep a closer eye out for cervical cancer. Okay. Okay, so the mesometrium, this gives lateral support, so it's part of the broad ligament. The cardinal ligaments, these come from the cervix and the superior vagina, and they run to the pelvic lateral walls, and they also help to support the uterus. The uterosacral ligaments, they secure the uterus to the sacrum, right? It's in the name. And the round ligaments, these bind the uterus to the anterior wall. Okay. So if the uterus becomes unsupported for whatever reason, it can prolapse. Okay, so it can prolapse means it sinks inferiorly, and the tip of the cervix can actually protrude through the vagina. Okay, so this can be caused usually by childbirth, so overstretching or tearing of muscles during childbirth. Okay, so even though it has all those anchoring ligaments we talked about, it's mainly supported by the pelvic floor muscles, and those are prone to damage, especially from like pushing from childbirth or from just being pregnant and that weight pushing down on the muscle. Okay, so we talked about the layers of the uterine wall, so I'm going to pass through that. The endometrium specifically has two main layers or strata. Okay, so the stratum functionalis, or functional layer, this is the layer that changes in response to the ovarian hormone cycles, which we'll talk about soon. Okay, and this is also the layer that is shed during menstruation. And then there's also the stratum basalis, or basal layer. This forms a new stratum functionalis every month after menstruation. Okay, so it does not change based on the ovarian hormones. It doesn't shed like the stratum functionalis. Okay. Okay, so the vascular supply in the uterus is going to play a key role in the changes. Okay. So I showed you the arteries. So we have the uterine artery. So that comes kind of to the side like this. Branching off of that is the arcuate artery. So it kind of branches up into the endometrium. Okay. Then after that, we have it branches off into two straight arteries and spiral arteries. Okay. So it's going to branch into straight arteries that come off like this, and then spiral arteries, which just kind of spiral around. And I'll do my best to draw that. Okay, so these spiral arteries are going to break down. Okay, so they repeatedly degenerate and regenerate, but the straight arteries do not. Those stay the same. They don't break down. Okay, they don't degenerate. Okay. So in the cervix, there are cells, secretory cells, and they secrete cervical mucus. Okay, so this cervical mucus is more hospitable to sperm during ovulation. Okay, and this is because it's less viscous and more alkaline. Okay, so it helps to nourish the sperm and help out with fertilization. Okay, the vagina is just a thin-walled tube. Okay, so it functions as the birth canal, so it's where a baby passes through during birth. It's also a passageway for the menstrual flow, and it's the female organ of copulation. Okay, so it extends, it's found between, remember the bladder was more anterior and the rectum was posterior. The vagina is in between those two, and it comes right under the cervix of the uterus. Okay. The urethra runs parallel to it but anterior to it, so it's two separate canals. Okay. So the layers of the vagina, there is an adventitia, which is made up of fibroelastic tissue, a muscularis, which has smooth muscle tissue, and stratified squamous mucosa, and there is rugae within the vagina as well. Okay. So secretions of the vagina are going to be acidic in adults, but in adolescents it's more alkaline. Okay. So the mucosal layer near the vaginal orifice, so the outer opening of the vagina, forms a partition called the hymen, so it's like partially closed. Okay, and that is going to rupture with intercourse, or it can rupture during sports and things in adolescence. Okay, and then the fornix, that's the upper end of the vagina, the area that surrounds the cervix. So remember, we had an anterior and a posterior fornix. Okay, external genitalia. So let's go through the purposes of those external genitalia. I already showed you where they're found. So the mons pubis, this is just a fatty area over the pubic symphysis. Okay. Labia majora, so it's a hair-covered fatty skin folds. Okay, and it's the counterpart of the male scrotum. Labia minora are skin folds that are within the labia majora. The vestibule, this is just the recess that's found within the labia minora. Greater vestibular glands, those were the ones on the sides of the vaginal opening. Okay, and they're homologous to the bulbourethral glands in males. So we talked about this in the anatomy video, but they release mucus into the vestibule for lubrication. The clitoris, this is anterior to the vestibule. The glans is the exposed portion, and the prepuce hoods the gland, so it kind of comes over the glands. Okay, so the clitoris is the counterpart of the penis, and the body of the clitoris has erectile tissue, right? It has that cavernosa tissue like the penis has. And then the bulb of the vestibule, this lies along the sides of the orifice, and they engorge with blood during sexual stimulation. Okay, mammary glands. So we talked about those already in the anatomy video. Okay, and the purpose of all of those different areas. It's for milk production. So milk is produced in those alveoli that make up the lobules. That's sent into the mammary duct, right? Okay, and then into the lactiferous sinus, and then out of the nipple. Okay. Okay, so the ovarian follicles, those have the oocytes in different stages of development, okay? So it'll have the oocytes, the follicular cells, and granulosa cells. The mature or Graafian follicle, that larger one that I showed you in the anatomy video, that is right before it's ready to rupture and expel the secondary oocyte, okay? After that's expelled, a corpus luteum is going to develop, and that is when the empty follicle will produce progesterone, estrogens, inhibin, and relax, and we're going to go through what those all do. Okay, so we talked about spermatogenesis in the male reproductive system. In the female reproductive system, formation of gametes is known as oogenesis. Okay, so this process begins in the fetus. So before a female is born, meiosis starts. Okay. So the primordial germ cells are going to migrate from the yolk sac to the ovaries when the fetus is developing, and then differentiate into oogonia. Okay. So we start with primordial germ cells, and those become oogonia. Okay, and then those divide into other germ cells, and some of those will become primary oocytes. Okay. Primary oocytes. Okay. So from the oogonia to the primary oocytes, that occurs via mitosis. Okay, so it's just replicating itself into primary oocytes. Okay, so these primary oocytes then will have the normal 46 chromosomes. Okay. Then those primary oocytes undergo meiosis 1 to produce secondary oocytes. Okay, so now I have secondary oocytes via meiosis 1. Okay, remember we talked about the steps of meiosis when we talked about the male reproductive system. Okay. Then some of those secondary oocytes are going to undergo meiosis 2 to produce ova. So those are the gametes of the female reproductive system. Ova via meiosis 2. Okay. So there are 3 main differences between oogenesis and spermatogenesis. in females, right, we already said the primary production of those primary oocytes occurs in the fetus. So this all happens in fetal development, in the fetus, okay? In males, this happens after puberty, okay? Second main difference, in the primary oocytes, meiosis is going to be stopped in late prophase 1 and only resume later, right, during puberty. Okay. Third difference is in the secondary oocytes, meiosis is stopped in metaphase 2, and it only finishes if fertilization occurs. Okay. So at birth, females are born with their lifetime supply of primary oocytes, not ova, primary oocytes, and then those can become ova if fertilization occurs. Okay, so the ovarian follicles, these are the functional units of the ovary that enclose the oocyte, okay, and then the oocyte is going to be surrounded by granulosa cells and pregranulosa cells. So granulosa cells are the second layer, so only if there's 2 layers present, okay? All right, so in the primordial follicle, there's a single layer of pregranulosa cells surrounding the primary oocyte. In the secondary follicle, that's where you have multiple layers of the granulosa cells. And then in the vesicular follicles, also known as the tertiary follicles, there starts to develop a fluid-filled cavity known as the antrum. Okay. Okay. So the primary oocytes, right, we said we're going to be arrested or stopped in prophase 1. Only a small number of those are going to be recruited into a pool, okay? So the follicles have 2 different fates. Atresia, which is apoptosis, programmed cell death of the oocyte and the cells surrounding it. Okay, so most of the follicles are never recruited, about 99.9%, right? Or ovulation is the other fate of a follicle. So after puberty, every single month, a few primary oocytes are going to be activated, okay, to undergo meiosis 1. Okay, so this is caused by follicle stimulating hormone. Okay, so FSH. Okay, so FSH is going to stimulate these to undergo meiosis 1 and become secondary oocytes. Okay. And then one from this group is going to be selected each month to become the dominant follicle. Okay. Okay. So let's kind of put that all together again. Okay. So at birth, we have all of our primordial follicles, okay? So they're already present and containing their primary oocytes, which are arrested in prophase 1. So let's draw that here too. Arrested in prophase 1. So they don't move past prophase 1. Okay, so they don't fully undergo meiosis 1 yet. Okay. So we go from oogonia to germ cells into our primary oocyte via mitosis, okay? Let's take this off because this is kind of confusing. Let's just say we go from oogonia to our primary oocytes. Okay, that middle step's not that important. Okay, via mitosis. Okay. Then, after puberty and until menopause, those primordial follicles will grow and develop. Okay? So this starts to happen before puberty, where they grow and develop. Okay? So we go from our primordial follicle to a primary follicle to a secondary follicle. We're not talking about oocytes, we're talking about the follicles here. Okay? Okay, what's happening to the oocytes is the primordial, primary, and secondary follicles all contain those primary oocytes that are arrested in prophase 1. Okay, then after puberty starts, some of the vesicular follicles, so we go from secondary follicles to vesicular follicles, they're going to be rescued from atresia, which is when they're arrested in prophase 1 here. That's remember, atresia was they can undergo apoptosis. So they're going to be rescued from undergoing apoptosis. Okay? And the primary oocyte in the dominant follicle will complete meiosis 1. Okay? So meiosis 1 will be completed and we'll get our secondary oocyte. Okay? We'll also get a first polar body, which is not a useful oocyte. Okay? Okay, and then ovulation will occur where that secondary oocyte is released. Okay? And then that is the one that can become an ova. Okay, so the ova is only when meiosis 2 is only completed if a sperm penetrates the oocyte. Okay. So remember we talked about after meiosis 1, we get our secondary oocyte. So the secondary oocyte has almost all of the mother cell's cytoplasm and organelles. And then we also get a polar body. So I'm just going to draw this here, polar body. Okay, so the polar body is a small cell that has almost no cytoplasm. Okay. Then the secondary oocyte, right, arrests or stops in metaphase 2. And this is the cell that can become the ovulated ovum. Okay. If it's not penetrated by a sperm, the oocyte is going to just deteriorate. So most cells just deteriorate as secondary oocytes. Okay. But if penetrated by a sperm, it quickly completes meiosis 2 and we get an ovum. So this is a large cell with enough cytoplasm to nourish a fertilized egg for the journey to the uterus, and this takes about 6 to 7 days. Okay. We also, when we get the ova from meiosis 2, we also get a secondary polar body. Here we're coming from here. This is also not a cell that's going to end up doing anything. It lacks a cytoplasm and it ends up degenerating and dying, just like that first polar body. Okay. So, some other differences between oogenesis and spermatogenesis. In oogenesis, there's going to be only one viable haploid ovum, and then 2 to 3 polar bodies that are also haploid, but they're not useful for anything. okay? Whereas from spermatogenesis, we go from 1 to 4 viable sperm, okay? In oogenesis, we only get 1 viable cell, okay? Okay, we talked about oogenesis begins in the fetus, or spermatogenesis begins in puberty, and the error rates are different. Okay, so spermatogenesis has an error rate of only 3 to 4%, whereas oogenesis has an error rate of 20%. Okay, so the follicles in oocytes can take about a year to mature before ovulation can occur. So it occurs in 2 phases. We have the gonadotropin independent preantral phase, and phase 2, which is the antral phase. This one is stimulated by follicle stimulating hormone and luteinizing hormone. Okay, so this is where the dominant follicle is selected and the primary oocyte can resume meiosis 1. Okay, so after puberty, every single month, follicle stimulating hormone and luteinizing hormone are going to stimulate development of the primordial follicles, and a few of them are going to grow and develop into primary follicles, but usually only one of them reaches maturity each month. Okay. All right, so let's go into the stages of the follicle development in more detail. So primordial first becomes a primary follicle, okay? So the oocyte is going to secrete a glycoprotein substance that forms the zona pellucida, and this encapsulates or surrounds the oocyte. Okay, this happens in the primary follicle. Then the primary becomes a secondary follicle. So the pregranulosa follicular cells are going to proliferate or copy, and they're going to form stratified cuboidal epithelia around the oocyte. Okay. Then when you have more than one layer of cells, they're known as granulosa cells. Okay. And now that primary follicle is known as a secondary follicle. Okay. Then granulosa cells and the oocyte guide each other's development via connections of gap junction connections. Okay, and then those connective tissue and granulosa cells are going to condense to form the theca folliculi. Within those, there are thecal cells that secrete hormones in response to luteinizing hormone. Okay, then the secondary follicle becomes an antral follicle. Okay, so liquid is going to accumulate between the granulosa cells, forming an early vesicular follicle. So the antrum is the large cavity that is formed because of all of that fluid. Okay, so that the antrum is what distinguishes the vesicular follicle from the antral, the vesicular follicle from the previous follicle, so preantral versus antral. Okay. Then the antral phase begins. So the secondary follicle, the antrum continues to expand as more and more fluid fills it. Okay. So now the oocyte with its surrounded granulosa cells is known as the corona radiata. Okay. So this sits on one side of the follicle. Okay, and then when the follicle becomes full size, it starts to bulge out from the ovary surface. Okay, and that's when it's ready to be ovulated. Okay, so after the oocyte and the corona radiata are ejected, the ruptured follicle then transforms into the corpus luteum. So this is a gland structure. Okay. Okay, and there's lots of pictures in the PowerPoint, so make sure you look at what all those different things look like. Okay. So basically we go from a primordial follicle from fetal development into a primary follicle. Okay, so it goes into a primary follicle once we reach puberty, then into secondary, then a mature Graafian follicle. This is where the antrum starts to fill with fluid. Okay, and then because of all that fluid buildup, the secondary oocyte is going to be released because the follicle is going to rupture. This is known as ovulation. Okay, and then we can go from our secondary oocyte to an ova if fertilization occurs. Okay, let's stop there for part 1.